Dr. Shabir, welcome to Let the Quran Speak.
Pleasure to be on.
We are continuing our series on hadith, Dr. Shabir, and now we want to look at some hadith that support pre-modern medical treatments. And many Muslims follow these hadiths even to this day. So they will use, for example, honey or black seed, and they will think that it's a cure for all things, right? Because there is a hadith that says the black seed is a cure for all things. So even, for example, for cancer, there will be, if a Muslim says they have cancer on some social media platform, there will always be a comment saying, try black seed, which is not really the solution that they need at that time, right? So what are your thoughts, Dr. Shabir, on those hadith which seem to be different from modern medicine?
Before talking about the hadith, Safiyyah, just to clarify, the Quran, of course, mentions honey as having curative properties, but this is in a general way. The Quran does not say specifically that for that disease you apply this honey or this amount or anything like this. And so the Quran does not present a problem for Muslims in this way. One can say, okay, maybe honey can have some simple uses if, in ancient times people suffered from something, maybe they lacked sugar and they needed a quick fix, they could use some honey or something like this, without making it so very specific. Now, when we come to hadiths, we have specifics that become problematic. For example, there is a narrative that a certain person came to the Prophet, peace be upon him, complaining and that his brother has bowel movements, so he needs a solution for that. And the Prophet, peace be upon him, said, give him honey. So the man went back and he came back and he said, well, the matter only has become worse. The Prophet said, well, give him honey. And he went back and he came back and he said, it's gotten worse. And the third time, same thing. Then the Prophet, peace be upon him, said, what God said is true, and your brother's tummy has lied. So, give him honey. And the man used the honey the fourth time, and then he got better. So whether he got better because he used honey or he got better naturally or whatever, the science is not reported. Only this interchange between the Prophet, peace be upon him, and this questioner. So should we conclude from this that yes, if anybody has bowel movements, this is what you do, you give them honey? Or should we ask our doctors today, what is the treatment for bowel movement? Now, I'm not denying that there may be a lot of benefits still in alternative medicine, and there are a lot of people who are attracted to alternative medicine, and they use alternative medicine. But it seems to me that for major ailments, people are turning to modern medicine. Because modern medicine deals with things that alternative medicine could not have, traditional medicine could not have dealt with. If we talk about things that require MRI and all of this, how is this going to fit in with alternative medicinal cures? You mentioned black seed. Now, there is a hadith that mentions that black seed is a cure for everything except death. So naturally, Muslims armed with a hadith like this is going to prescribe black seed for everything. But it seems that nobody's going to prescribe black seed and then stay with the black seed. Like you mentioned cancer, for example. While they're saying try black seed, they're not going to say don't do anything else. Whereas some hadiths mention some cures and say that if you do this, you won't need any other treatment. For example, cupping. Cupping, known as hijama in Arabic, may have two different forms. There is a wet cupping and a dry cupping. Cup is placed on the skin, and a vacuum is created within the cup. So there is a suction that draws the blood towards that area. The blood would coagulate there, and then in the Muslim understanding, this hijama, there is a wet cupping. So an incision, a small one, is made, and the blood is then drawn out, or some blood anyway. And it is mentioned that the Prophet, peace be upon him, said that if you get the cupping done on your head and between your shoulders, you won't need any other treatment. But I hardly would I see that any Muslim would, even those who practice this hijama, would say, okay, we did this, so nothing else is to be done. And the whole area of hijama, we have hadiths mentioning, for example, you are, better to do the hijama, this cupping, on the 17th, 19th, or 21st of the month. So why these particular days? Is the mercy of God somehow more prevalent on these days? Why these days? It's not so very clear. Just the hadith barely narrating this. And of course, any one of these days could be any day of the week, right? And it varies from month to month. Whereas on the other hand, there's a hadith says that there's a hadith that says that do not do the hijama, the cupping, on a Tuesday, because on Tuesday there is an hour when the blood doesn't stop. Mm-hmm. So this is called the day of blood. That is Tuesday. So obviously these two are in conflict, because on the one hand, you're recommending doing it on the 17th, 19th, or 21st. On the other hand, you're saying don't do it on a Tuesday. But the point here is that different people are narrating these, Safiyyah. Uh-huh. It's not like the one person knew from the Prophet, peace be upon him, or knew from his contemporaries that the Prophet, peace be upon him, said both things, and then he's reconciled them all. Like the one person telling you, you know what, the Prophet said do it on 17th, 19th, and 21st, but not if one of those days is a Tuesday. Huh. You know, that would be a perfect reconciliation that comes from the earliest generation. But what we have is that one narrative comes through the generations, through one chain of narrators, a relay chain, and another narrative comes through another chain of narrators, and the two are in conflict. So today we might want to reconcile them and say, okay, there's no conflict, because if we look at that one this way, look at this one the other way, squint this way, then the two of them will be seen to be, intersecting and of the same. They're on the same page. But we can make that reconciliation. But you're wondering, why wasn't it reconciled before? And if I add a brief note about this, if you think about the number of narrators between the Prophet Muhammad, peace be upon him, and someone like, let's say, Imam Bukhari or any one of the other collectors of the major books that we have, who wrote in the 3rd century. So we have a couple of 100 years passing between the Prophet, peace be upon him, and these collectors. Uh-huh. So if you have, let's say, 5 narrators between them, you have to imagine one of them living to a ripe old age, passing the information on to a younger person, who will then live to a ripe old age to pass it on to another person, who will then live to, and so on. So if you think of the first generation living to the ripe old age and gathering all of the information that you could expect them to know from that period of time, then the reconciliation should already have been done. In some cases, to be sure, the reconciliation is done. You will find a hadith that says that, okay, the Prophet used to prohibit this, but then he permitted it. So that's the reconciliation already done there. Uh-huh. Sometimes it's not done, and we're doing it now. But that reconciliation itself, though apparently being done by the first generation, that could be their inference too. It could be that two persons were saying two different things, and somebody reconciled them already, and then we have a single narrative showing the reconciliation. It doesn't mean that the Prophet, peace be upon him, actually said the two things at the two different times. So here we have a perfect example where, though we were talking about medicine, we have a perfect example of how things are left unreconciled, hadiths contradicting each other. And yet, what we do is that we ignore the contradictions. We pick the ones that we want. Okay, hadith that says do hijama, cupping, and we do cupping. And then not me. I haven't done it. But some people do it to this day. We want to hear one more example?
Sure.
Okay, so cauterization. People would have cauterized wounds at the time in order to stop the bleeding. So, simple measure, right? But the Prophet, peace be upon him, according to one set of hadiths, prevented Muslims from cauterization. And one might infer that maybe the reason is that using fire, using heat, this is associated with hell in Muslim thinking. We don't want to apply that to a person, okay? Cauterization, no go there. All right? But then on the other hand, you have more than one hadith saying that the Prophet, peace be upon him, applied cauterization as a cure for one or more of his companions who were wounded in battle or something like this. So here too you have the contradiction and you have the prohibition of cauterization. So which one are we going to apply, and which really is the medical cure? We should say in retrospect and in conclusion that the Prophet, peace be upon him, was a wise man of his time. He applied the cures which were known and avoided the things which were either detestable from a Muslim point of view or thought to be harmful. But we should not take this as part of our religion, and that our religion prescribes either black seed or honey or this or that as our cure for all time. It might have worked at one time, that was good for the people, but now we have better cures which are inspired by Allah. Allah has inspired the scientists and people of medicine to develop the best cures and practices in our modern times, and we should avail ourselves of that as being God-given.
I appreciate your thoughts, Dr. Shabir. Thank you.
You're welcome. The most effective and far-reaching dawah we can do these days is on social media. That's why we're developing the Muslim Media Hub. We're harnessing the power of media to spread the message of Islam. Please support this project at QuranSpeaks.com and share in the reward from God.